Hi, it's Patrick Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated patients and medically complex patients at home. In today's blog of the Intensive Care at Home series, I want to answer a question from Paula. Now, Paula has the following situation. She says, my 18-month-old daughter has a very complex medical history given her short life. She was born prematurely. She had a cardiac arrest. She then ended up with hypoventilation syndrome, and she also was diagnosed with brain cancer about 6 months ago. She has been through chemotherapy in all of her 18 months. She has a tracheostomy, and we are stuck in the pediatric ICU, and we are in Melbourne, Australia. What can we do to get my daughter home? Me and my husband have been living in ICU for the last 18 months, and we haven't really been able to get home, look after our 4-year-old son, and our family life is just horrible. What can we do as the next steps? I'm hearing that intensive care at home can take ventilated adults and children home, and how can we go about it? From Paula. Well, thank you so much, Paula, for contacting us. So let's look at the positives straight away. Yes, we at Intensive Care at Home can get you and your daughter home so you can live a normal family life. How does that happen? Well, especially for our viewers in Australia, there is now the NDIS, the National Disability Insurance Scheme. And the National Disability Insurance Scheme is funding home care nursing for up to 24 hours a day, and that's how most of our clients are funded now. They're getting funding for nurses 24 hours a day, 7 days a week, 365 days of the year, as long as it's medically necessary. And for someone that is on a ventilator with a tracheostomy, it's medically absolutely necessary. It's according to best practice, to evidence-based practice, which you can look up on our website, intensivecareathome.com, where we publish the home mechanical ventilation guidelines that clearly demand that any ventilated patient, either inside or outside of intensive care, needs to have an intensive care nurse with them 24 hours a day, and that is the gold standard. The reality is that adults and children have died at home with tracheostomies or ventilation if they're not looked after 24 hours a day by intensive care nurses, and that's just a tragedy, and it needs to be avoided, full stop, whilst also looking at the quality of life for clients at home so that they can leave intensive care as quickly as possible, which also, by the way, provides a win-win situation, because we're helping intensive care units to free up their beds and make room for other critically ill adults and children that are in need of intensive care beds. It's a win-win situation all around. And for you as a family, of course, you want to go home. We know from many families that have a situation like you are describing. They can't work, they can't look after other family members. Their whole lives are literally falling apart. And again, we can help to reinstate normality by getting clients home, with basically bringing the intensive care into your home rather than you going into intensive care, and again, funded by the NDIS. So what you should be doing as a next step, please contact us. Give me a call here in Australia. My number is 041 094 2230, and then we can take the next steps. For example, we need to get the advocacy rolling with the NDIS. We are very experienced in how to roll out the advocacy and how to get funding for you and for our other clients. Otherwise, we wouldn't be in business, because we have the expertise, we have the clinical knowledge. We also have the network that can help you to achieve your goals and get home and get out of ICU. We also provide our own support coordination here at Intensive Care at Home. We are certainly finding that most NDIS support coordinators are not clinical people, and especially when it comes to ventilation with tracheostomy, you do want a team around you that understands intensive care, that understands ventilation and tracheostomy inside out. Here at Intensive Care at Home, we are employing hundreds of years of intensive care nursing experience. You couldn't be in better hands because we're having a wealth of knowledge employed within our business, and we are dealing with the NDIs and the funding side of things on a day-by-day basis. So reach out to us and we can help you get your child and your family home as quickly as possible with 24-hour intensive home care nursing to make it safe for your ventilated daughter to be at home in the comfort with your family. So that is my answer to today's question. If you have a loved one in intensive care and you are in a similar situation, again, please contact us on one of the numbers on the top of our website. If you don't know how to go about funding, whether it's NDIS, whether it's TAC, whether it's the DVA, Department of Veteran Affairs, or Department of Health funding, again, you should contact us because, again, we are dealing with all of these funding bodies and we can help you to access the funding that you need for you or for your loved one. If you are an intensive care nurse with a minimum of 2 years ICU or pediatric ICU experience and ideally have completed a postgraduate critical care qualification, we certainly want to hear from you. We are looking for ICU and pediatric ICU nurses in the Melbourne metropolitan area, in South Gippsland, Warragul, Trafalgar, Leongatha, Druin, but also in Sunbury, in Wagga Wagga, in Sydney, in Wollongong, in the inner city area, in Melbourne, northern suburbs. So we have job opportunities for experienced and highly motivated intensive care and pediatric intensive care nurses in those areas. We definitely want to hear from you. We have also been part of the Melbourne Health Accelerator program in the past for innovative healthcare companies. Thank you so much for watching this video blog. This is Patrick Hutzel from Intensive Care at Home, and I'll talk to you in a few days.